Last week, we took a look at the number of mothers who have taken the lives of their children as well as tried to take their own life. Some really devastating stories we started to dive into, and many of these cases were attributed in part to postpartum depression. Now the FDA is testing a new pill to treat postpartum and major depression. So if this is approved, it could be available in pharmacies by the end of the year. Zuranolone is a pill taken once a day for 2 weeks. It's only the second drug made specifically to treat postpartum depression. The other medication, which is made by the same company, Sage Therapeutics, needs to be administered through an IV at a healthcare facility, causing barriers for some to access this treatment, as you could imagine. So joining us live this morning is Dr. Samantha Meltzer-Brody. She's the director of the UNC Center for Women's Mood Disorders, which is one of the treatment sites that participated in the clinical trial for the drug. Thank you so much for joining us today, Samantha, because like I said, this is a very devastating topic that not a lot of people talk about. And I think for a lot of people, postpartum depression is something that they struggle through alone, and that doesn't have to be the case. So what kind of effect did the drug have on patients that participated in your trial? Can you walk our viewers through that first?
Yeah, thanks for having me. So postpartum depression is one of the most common complications of childbirth, and it can be more mild or more severe and can have devastating consequences, including maternal suicide or horrible outcomes. The recent case you were mentioning generally sounds like postpartum psychosis, so I just want to highlight that. For most women that suffer with postpartum depression, it can be something that is readily treated. And new treatment options like zuranolone would be an important new tool. So in these clinical trials, we have been impressed with the treatment response. It is fast acting. So unlike traditional antidepressants, the woman starts feeling better quickly. The mother starts feeling better quickly. This drug is taken over a 2-week period of time, and generally after the first week, people start seeing a significant response, and it's very well tolerated.
So the pill is only taken for 2 weeks, obviously way more convenient than the IV treatment that is given over that 60-hour period. I imagine people that, you know, have jobs, full-time jobs, or families that they need to take care of, that can create a barrier for that kind of treatment. But how would this transform how postpartum depression is treated?
Well, I think it will be huge. So we studied brexanolone, the IV drug, and did actually the initial studies at UNC. And it's a powerful drug. It's a 60-hour infusion. So in general, with that drug, people start feeling better very quickly within a day, and it's a powerful drug. As you mentioned, it is inconvenient. And so this drug, I think, will be something, because it has fast onset of action. You take it 2 weeks, and in the clinical trials, people remained well out to 45 days. So what is unknown is what happens after that, because that's the length of time in the studies. But it will be an important new tool. Right now, the traditional antidepressants like the SSRIs, they can take weeks to months to work, and only some percentage of mothers actually respond. And so while it's useful, it certainly is not able to treat the vast needs of women that suffer with postpartum depression, for which medication is an appropriate treatment. This new treatment in the clinical trials and in the publications, because of the fast onset of action, the ability to reduce suffering quickly. And that's what you need for moms and babies and families in this period. You need something that works fast and that is convenient. That, I think, can be a real game changer.
So when you're a new mom, I'm about to be one. I'm 38 weeks pregnant, so I'm about to be a new mom. And
congratulations.
Thank you so much. But how can you tell the difference? I mean, when you're talking about postpartum depression, I mean, how can you tell the difference between just being tired, being overwhelmed, being anxious, all these things? How do you know when you have a problem so much so that you need a medication like this?
Well, motherhood and the transition to having a baby is a profound time. Most women will report feeling normal feelings of being a little overwhelmed, feeling tired. Giving birth is a very big deal, and that's called the baby blues. Most women report feeling more emotional in the first few weeks of having a baby. The symptoms of postpartum depression are different. It is lack of joy, low mood, feeling anxiety that's extremely uncomfortable, interfering with functioning, not feeling like your usual self at all, and in more severe cases, having thoughts of not being able to function or having thoughts that life is not worth living or thoughts of suicide. So postpartum depression is a major depressive episode. It is very, very different from the baby blues. And there's many ways to screen. The important thing is if any mother is feeling completely overwhelmed, not herself, not able to function, or having concerning thoughts, talking to your doctor or other care provider, talking to family is so, so important to get treatment because there is help available and no mother should have to suffer with this in silence.
Absolutely. Dr. Samantha Meltzer-Brody, director of the UNC Center for Women Mood Disorders. Thank you so much for your insight in walking us through this treatment that could be available by the end of this year, if approved. Thank you so much.
Thank you. Bye-bye.